Have you ever walked into a room and forgotten why you were there? Or maybe you've found yourself struggling to remember a name not once, but again and again? What if I told you that the very pills you take to help your heart, your sleep, or even your mood could be slowly making your memory worse? Yes, even medications prescribed by your doctor, taken exactly as instructed, may be interfering with your brain's ability to think, remember, and stay alert. And the most dangerous part? It doesn't happen overnight. It creeps in silently, slowly like a fog you don't even notice until it's too late. If you're over 60 and on daily medications, this is something you simply cannot afford to ignore. Hi, I'm Dr. Ethan Wells, and today, I want to help you take a closer look at 5 common medications that millions of older adults use every single day, which might be quietly affecting your memory without you even realizing it. I've seen it again and again in my clinic. A patient comes in, worried about early signs of memory loss, only to discover that it wasn't age or Alzheimer's. It was something sitting right there in their medicine cabinet. So if you or someone you love is taking medication regularly, this video could be one of the most important you watch all year. If you're watching from California, Florida, New York, or anywhere around the country, leave a comment below. Let me know what medications you're currently on or any memory changes you've noticed. And don't forget to hit that subscribe button, because each week on this channel, I break down the truth behind common health questions that matter most after 60. Memory loss isn't always the first sign of aging. Sometimes, it's a warning signal from your brain that something is out of balance. According to the National Institute on Aging, nearly 40% of adults over 65 take 5 or more prescription medications daily, and while each one may be necessary, the combination or long-term side effects can slowly chip away at memory, focus, and cognitive clarity. I've had patients who were sharp, articulate, and independent, but over time, they began to lose track of conversations, forget appointments, or feel like their thinking was slower than usual. Many of them assumed it was just aging, but when we looked closer at their medications, a pattern emerged. Certain drugs, especially those that affect the brain's chemical messengers, were the hidden culprits. And here's the frightening part. By the time noticeable memory changes appear, some of the brain effects may already be deep-rooted. That's why early awareness is key, because while we can't always eliminate every medication, we can choose smarter, safer alternatives and protect the brain along the way. And that's exactly what we're about to do in this video. 1. Could your sleeping pill be slowing down your brain? Name: benzodiazepines e-gram, lorazepam, diazepam, alprazolam. Main benefit: helps reduce anxiety, induce sleep, or calm panic attacks. Explanation: these medications work by calming brain activity, but in older adults, that same calming effect can interfere with memory processing. They suppress the hippocampus, the area of the brain responsible for forming new memories. Result: daily use can lead to brain fog, confusion, and even increase the risk of dementia over time. Better option: ask your doctor if a gradual taper is possible. In many cases, natural sleep aids like melatonin or cognitive behavioral therapy for insomnia, CBT1, are effective and safer for your brain. Warning: never stop benzodiazepines suddenly. It must be done under medical supervision. 2. Are your allergy pills secretly blocking your memory? Name: anticholinergic drugs, e.g., diphenhydramine, oxybutinin. Main benefit: relieves allergies, helps with bladder control, motion sickness, or certain types of depression. Explanation: these medications block acetylcholine, a critical brain chemical involved in memory and learning. Result: older adults are especially vulnerable. Long-term use is linked to faster cognitive decline and increased dementia risk. Better option: for allergies, try non-drowsy alternatives like loratadine, Claritin. For bladder issues, ask about newer generation medications with fewer effects on the brain. Warning: if you're using Benadryl or similar drugs daily for sleep or allergies, talk to your pharmacist. You may have safer options. 3. Could your cholesterol medication be clouding your mind? Name: statins, e.g. simvastatin, atorvastatin. Main benefit: lowers cholesterol to prevent heart attacks and strokes. Explanation: while statins are life-saving for many, some users experience reversible memory problems. The brain contains a large amount of cholesterol, and lowering it too much may affect how brain cells communicate. Result: some patients report memory lapses, word-finding difficulty, or slower thinking after starting statins. Better option: don't stop statins without talking to your doctor. A dosage adjustment or switching to a different statin may solve the problem. Reminder: heart and brain health must be balanced. One should never be sacrificed for the other. 4. Is your antidepressant hurting more than it's helping? Name: tricyclic antidepressants, e.g. amitriptyline, nortriptyline. Main benefit: treats depression, nerve pain, and sleep problems. Explanation: these older medications also block acetylcholine the same way anticholinergics do. That makes them risky for brain health in seniors. Result: many seniors on these drugs feel mentally slower or more forgetful over time. Better option: newer antidepressants like SSRIs, e.g. sertraline or escitalopram, are often gentler on memory. Ask your doctor about switching if you're experiencing cognitive changes. Note: these medications are sometimes prescribed off-label for sleep. Be cautious, especially if taken long-term. 5. Are you taking antipsychotics for sleep or anxiety? Name: atypical antipsychotics, e.g. quetiapine, hispididone. Main benefit: originally meant for schizophrenia or bipolar disorder, but often used off-label for agitation, sleep, or behavioral issues. Explanation: they alter dopamine, another chemical vital for memory and decision-making. In older adults, they can slow thinking, increase fall risk, and worsen memory. Result: studies show increased risk of stroke and death when these drugs are used inappropriately in older patients. Better option: if these medications are being used for sleep or anxiety, ask your doctor why. There may be safer, non-drug alternatives like behavioral therapy or low-dose melatonin. Warning: these drugs should be used with extreme caution in the elderly and only when absolutely necessary. If you were my patient, here's what I would tell you. First, don't panic. Just because you're taking one of the medications we discussed today doesn't mean you're destined to lose your memory. But it does mean it's time to have a thoughtful, informed conversation with your doctor. Many times, there's a better alternative, a safer version, a lower dose, or even a lifestyle change that can replace the need for the medication altogether. Second, never stop a medication on your own, especially those related to sleep, anxiety, or blood pressure. Doing so suddenly can be dangerous. Instead, keep a journal. Write down when you feel forgetful, foggy, or unusually tired. Bring that journal to your next doctor's appointment. It's one of the simplest yet most powerful tools to help your provider spot a pattern. Lastly, remember this: your brain is not a lost cause. It's resilient. It can heal. And the sooner you take action, the better chance you have of preserving the memories that matter most: your family, your stories, your independence. Let's recap. 5 common medications, from sleeping pills to allergy meds to certain antidepressants, may be quietly affecting your memory after age 60. But the good news? Now that you know, you can take back control. Start by reviewing your medication list. Talk with your doctor. Ask the hard questions. Because every small adjustment you make today can protect your brain and your independence for years to come. And if this video opened your eyes, you won't want to miss the next one. where I'll reveal the 3 biggest mistakes seniors make when taking vitamin B12 and how to avoid them. Until then, I'm Dr. Ethan Wells. Live smarter, live stronger. Starting today,